Hello students, today I am going to teach class 12th subject biology chapter 8. Chapter name is the human health and disease. Today our topic is malaria. In about malaria, the disease is known the mankind for centuries, but the cause of the disease was unknown. People thought that the air was the agent causing it. It is a seasonal disease usually occurring from August to November. Malaria itself means foul air. A type of malaria on the basis of nature of fever, type of malaria mainly four types. First is the quarantine malaria, begin malaria, mid-tertian malaria, and malignant tertian malaria. The quarantine malaria, it is caused by the Plasmodium vivax. Its incubation period is 13 to 15 days, with fever occurring every 48 hours. Death rate is low in quarantine malaria. Begin malaria, it is caused by the Plasmodium malariae. Its incubation period is 28 to 30 days. The fever reoccurs affect every 72 hours. Mid-tertian malaria, it is caused by the Plasmodium ovale. Its duration is 10 to 17 days, with fever occurring every 48. Then malignant tertian malaria, it is caused by the Plasmodium falciparum. Its incubation period is 8 to 12 days, with fever occurring every 36 hours. Death rate is very high in this malaria. Symptoms of malaria: the temperature of the body is increased rapidly with the sinking chill, followed by the headache and nausea. There is profound sweating with the fall of the temperature. The symptoms are periodically repeated. Pain in the body, face becomes reddish, swelling in the liver and spleen. The treatment of malaria, diagnosis of the malaria is made by the blood test of the patient during fever. Drug employed for its treatment are the pentaquine, plasmoquine, quinine, camoquine, arberine, chloroquine, mepacline. It is resocine, so it is the medicine name. Then prevention of the malaria involves the elimination of mosquito and use of drugs. The use of mosquito nets, adequate screening of the doors, window, ventilators, covering the parts of the body, the application of repellent anti-mosquito cream, the fumigation also prevent mosquitoes. All breeding place of the mosquitoes should be destroyed. Use of DDT insecticides, spraying oil on the standing water. And last of the prevention of the malaria, use of drug in the malaria prone region help in preventing malaria. Then next human disease is the amoeboisis. Amoeboisis is the common disease caused by the Entamoeba histolytica. The symptoms: diarrheal, dysentery with the mucus and blood. The treatment: permanent relief from amoeboisis is difficult. Temporary relief is achieved by the dehydrometine Cheniophone, Vioform, Terramycin, Ardromycin. It is the medicine name. Then precaution, it can be prevented. It can be prevented by the adapting the hygiene method of the living. The important parasitic protozoans, Plasmodium vivax, is caused by the malaria, and Amoeba histolytica it is called amoeboisis. Trypanosoma gambiense, it is found in the human blood, called the African sleeping sickness. Leishmania donovani, it is caused by the cholera in human being. So next it is the Escherichiasis. Escherichiasis means caused by the Escherichiasis lumbricoides, commonly called the roundworm. Symptoms: stomach ache, weakness, vomiting, all the primary symptoms in the Escherichiasis. Treatment of the Escherichiasis: piperazine citrate syrup are used to control the Escherichiasis. Then next typhoid. Next is the typhoid. It is clinically called the enteric fever. Typhoid is caused by the Salmonella typhi. The incubation period about 1 to 3 weeks. Symptoms: a person suffering from typhoid so the fever usually high, pulse is slow, rose-colored eruption. It is the enlargement of the spleen, and headache and constipation are also seen in some cases. Okay, treatment of the typhoid: diagnosis is made up of the detection of germ in the intestinal discharge of the patient. The chloroamphenicol is the most widely used antibiotic for the typhoid. Combination of trimethamprim and sulfamethoxazole has been used for the chloroamphenicol, so it is used for the typhoid. Chloromycetin and antibiotic is also used for the treatment of the typhoid. Ampicillin are used to cure the typhoid. Okay. Then next disease is pneumonia. In about pneumonia, it is the infectious disease of lungs. Its incubation period is 1 to 3 days. Pathogens caused by the Streptococcus pneumoniae. Symptoms: alveoli of the lungs filled with a fluid due to which lead to the problem in breathing, cough with sputum, fever and suddenly cooling of body, coughing, sharp chest pain, lip and nails become grey in the bluish in color, abdominal swelling, blood red, coughing. So it is the symptoms of the pneumonia. Treatment of pneumonia is the dangerous disease. Treatment depends upon the several symptoms and the type of organism causing the disease. The medicine used for treatment the pneumonia: erythromycin, tetracycline, sulfonamide. Antibiotics are used for the treatment of the pneumonia. Then dengue fever. Dengue fever is the mosquito-borne tropical disease caused by the disease dengue virus. Symptoms: primary symptoms of dengue appear 3 to 15 days after the mosquito bite. The treatment of the prevention of dengue fever require control, eradication of the mosquito, carrying of the virus that cause dengue. Vaccine of dengue fever was approved in April 2016 are used for the dengue endemic areas. endemic areas. Next is the basic concept of immunology. Immunology, ability of the organism to, what is immunology? Resistant the pathogen, development of disease is known as the immunity, and the study of immunity is called the immunology. The concept of immunity was first started by the Edward Jenner in 1978. Type of immunity is two type: innate immunity and acquired immunity. Innate immunity, also known as the natural immunity, inborn resistance to disease of the other organism, as well as germ causing disease in other member of cause species. This kind of immunity is developed by the developing obstacle in the route of entry for entering external factors in our body. Okay, it is the innate immunity. Then second is the acquired immunity. Acquired immunity, it is the which is brought about a immune system which is developed after infection. It is two types: active acquired and passive acquired. So it is main the health, human health and disease. So today our topic is completed. Next topic I will take a next topic to you. Okay, thank you, students.